This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy listening to the Rational Wellness Podcast, please go to Apple Podcasts, which replaced iTunes, and give us a ratings and review. That way more people can find out about the Rational Wellness Podcast. Also, if you want to see the video version, you can go to my YouTube page, Weitz Chiro, or put in Rational Wellness Podcasts into YouTube. And if you go to my website, drweitz.com, you can find show notes and a complete transcript. So our topic for today is the brain-body connection, which is discussed in the Brain-Body Diet, Dr. Sara Gottfried's latest best-selling book about how to understand and improve your brain health by improving the brain-body connection. Brain health tends to deteriorate for women as they age, and this can be related to toxins, gut problems, diet, lack of exercise, sleep deficits, blood sugar imbalances, stress, hormones, nutritional deficiencies, and other factors. One fact that Dr. Gottfried discusses I found particularly interesting is that the enzyme that removes beta amyloid from the brain, and beta amyloid as it accumulates increases your risk of Alzheimer's, is the same enzyme that clears out insulin-degrading enzyme. So if you have higher insulin levels due to a lot of blood sugar spikes, your insulin-degrading enzymes won't be available to break down amyloid beta. Dr. Gottfried mentions in her book that a study from Harvard shows that only 13% of women can be classified as healthy agers, which means that they have no impairment of memory, physical fitness, or mental health and are relatively free of major chronic diseases. She then lays out a series of steps that women can take to promote healthy aging of their brains and their bodies. Dr. Sara Gottfried is an MIT and Harvard-trained medical doctor, a board-certified gynecologist, and also board-certified in preventative and anti-aging medicine. Dr. Gottfried is also now the Chief Medical Officer of Metagenics. She has written her fourth New York Times bestselling book, The Brain-Body Diet, to go along with The Hormone Cure, The Hormone Reset Diet, and Younger, her three prior best-selling books. Dr. Gottfried, thank you so much for joining me today.
Oh, I'm so happy to be here. That was like the most thorough bio I've ever heard in my life. And I love that you took maybe the most important takeaways that I have in my book. Like it just sort of warms my heart that you notice the insulin degrading enzyme and this fact that so few women are healthy agers. Like I think that's alarming. So thank you. Thank you for your careful.
Oh, absolutely. So I'd actually like to start this interview with a comment. So I was preparing for this interview on Sunday afternoon by reading your Brain-Body Diet book. And I was sitting on my deck in my backyard and I was sipping some organic red wine. And I came to your section on memory and you wrote, alcohol impairs memory, erodes mental function, reduces brain size, and causes brain cell dysfunction. Makes you want to put down that glass of wine, doesn't it? So if I have any trouble remembering what I want to say today, I have an excuse.
That's so funny. Well, yeah, I don't like to start with my feeling about wine because it's maybe the least popular message that I have. But let me say this. I think that, based on the epidemiology that we have on especially red wine in places like Italy and Europe, Framingham study, we know that men probably do better with alcohol than women do. So I think there's certain reasons for that. I mean, women have different sex hormones. We've got a different process in the liver. And I think part of the issue for women is that alcohol raises the bad estrogens and leads to a greater risk of breast cancer as well as other things, as little as 3 glasses of red wine per week. Right. So I think men can often get away with 1 to 2 glasses a day without any adverse outcomes. So I just want to reassure you that I think you're okay in the backyard. It sounds like you're getting a little nature, maybe some vitamin D, all those things are good.
Thank you. So why did you, Dr. Gottfried, why did you decide to stop practicing MIC medicine, in your words, and switch to a functional medicine or integrative approach?
Well, I wish it were as simple as just deciding to stop, because in some ways I think I was forced to stop, like my body forced me to stop.
Oh, okay.
So, and I think a lot of clinicians come up against this. Like, I imagine you have some listeners, a listener in particular who's got one foot in the allopathic medicine world and one foot in the functional medicine, holistic medicine world. And so trying to figure out how to reconcile those two worlds can be very tricky. So for me, I was practicing some of the concepts that we have from functional medicine. I was listening to the Jeff Bland tapes in the 90s, and I
listened to every one of those.
You listen to them too. Yeah.
I had the little cassettes I used to listen to.
I mean, there are people listening to this right now who don't even know what a cassette is. So I'm with you on that. But what happened for me is that I hit a wall. I hit a wall physiologically. I had so much stress. I had a couple of kids in my 30s. I was seeing 40 patients a day. And it just got to a point where I couldn't practice the quality of medicine that I was trained to deliver.
Right.
And I felt like I was failing my patients. I had patients who were coming to see me and saying, this antidepressant isn't working. I have PMS. It doesn't make sense to me that I would take Prozac every day. Or, I'm trying to deal with stress, and I'm not just going to go sit in a corner and meditate on a cushion. Like, that's not going to solve it. So What else do you have for me? So what I did is I had my own health crisis. I went to my primary care provider, realized that what he was offering was totally wrong. Antidepressant, birth control pills, because supposedly that helps with every hormonal imbalance. And I was overweight. I had issues probably with insulin degrading enzyme. And so I decided at that moment that I couldn't continue in MIC medicine, that I was on this path towards burnout. And so I built a bridge, an 18-month bridge, to get out of there and to build my own practice, the kind that would really serve patients the way that I felt like they needed to be served.
Great. What did that bridge look like, if you don't mind maybe just taking a minute? Because there probably are practitioners listening to this who are trying to figure that out.
Sure. Well, the cool thing is you can start the education while you're still in that allopathic realm.
Of course.
So, I was listening to Jeff Bland. I was starting to do some of the things he talked about. So I was starting to do really basic things. Even in a 7 to 15 minute appointment, I could talk about the elimination diet. I could order a fasting glucose and a fasting insulin. I could order a hemoglobin A1C. And so I could have conversations about those things. And we all know that something simple like an elimination diet, which we've been using for almost 100 years, that can reduce symptoms, like based on the MSQ, by 50%. So it's a pretty strong tool. So I started to practice in that way with education first. And then I built with a coach how to step away from the security of this insurance-based system.
That's the hard part, is when you're taking insurance for your medical practice, how do you start building that functional practice, which is not insurance-based?
Well, it's hard, and in some ways it's very liberating, because the reality is that taking insurance has become increasingly difficult. It's driven up, the number of patients we have to see each day. Reimbursement has come down. And so it's not a sustainable model. In fact, I would even say it's abusive.
Yes.
And it's serious. I mean, it's led to burnout to the level that we have something like triple the rate of the baseline suicide rate among US physicians right now.
Wow.
And it's higher than war veterans who have post-traumatic stress disorder. So we have a real crisis on our hands. And I think that the kind of medicine that we practice, Ben, lifestyle medicine, precision medicine, functional medicine, integrative medicine, whatever you want to call it, this is a solution to the burnout, and it's also a solution that serves our patients better. So it took me about 18 months to figure this out, to figure out, okay, where's where's the location, what's the minimum, the MVP, the minimal viable product, what are the, what's a pared down number of staff that I would hire, malpractice insurance, all those kind of pieces. It took a while. It took 18 months to get those together.
Okay, cool. So thanks for some of those insights. I'm sure that could be a long conversation at another time. So why did you decide to write this new book, The Brain Body Diet?
I wrote it for a couple of reasons. I'm a board certified gynecologist, from my allopathic days.
Yes.
And so the way that I tend to take care of patients is kind of starting with hormones. So the way that, my focus has been for 20 years, bioidentical hormone balancing. But what I realize is that it's really only part of the story, especially when you consider the matrix of the functional medicine model. And you realize that hormones are just, it's one node in the matrix.
Right.
So I realized, based on my own health issues, which always feels like, kind of a message from the universe about what I need to pay attention next, I realized that so much of hormonal balance is mediated by the gut, and I needed to pay more attention to it. And maybe most importantly, I realized that my patients who had no gut symptoms, so they didn't have gas or bloating or constipation or diarrhea or irritable bowel syndrome, right, they had gut issues. They had increased intestinal permeability. They had reduced microbial diversity, and they had dysbiosis, even in the absence of GI symptoms. So this is what got me to pay attention to this. And as I started to dig deeper, I realized, oh my gosh, the way that we're treating anxiety, the way that we're treating depression, the way that we think about cognitive decline really needs to be reset. Like, we have to change the paradigm, and we really have to put the gut microbiome brain axis at the center of this.
Yes. That's great. So how do you try to analyze the gut to see what might be going on that might be affecting brain health?
Well, I still think it's helpful to ask, to do a thorough history and physical. Right. I think you can get a lot from that. Right. I use the MSQ for all of my patients. Do you use it too?
Yes, absolutely. Practice? It's incorporated into the initial paperwork. Yep.
So I find that so helpful. But when I go back and I look at my patients, so few of them have gut symptoms. So the way that I assess it, in the history, I'm thinking in particular about the gut disruptors. I'm thinking about antibiotics, like how many courses have you had? Because we know even a single course of antibiotics is associated with a greater risk of anxiety, depression, insulin resistance, obesity, diabetes, learning and memory problems.
Yep.
In multiple courses, the rate goes up. So I ask about that on history. I ask about food, of course. I've got a food first philosophy. I imagine you do too.
Sure.
And then I also ask about other toxins, things like glyphosate, things that disrupt the integrity.
Glyphosate's contained in Roundup, which is an herbicide, a pesticide that's often sprayed on foods, and especially in genetically modified crops.
That's right. And when I started to test my patients for glyphosate, I was really surprised at how many of them had a toxic load of glyphosate, even though they were eating primarily organic food.
Use that Great Plains urine test?
I use Great Plains. So you asked about assessment. So I start first with, some of the blood biomarkers that I think are helpful. So I want to know about stress and cortisol and the hypothalamic pituitary adrenal thyroid gonadal axis. Of course, that's kind of my focus. And we know that if you are someone who's chronically stressed, the high cortisol can poke holes in your gut lining, can disrupt the integrity of your gut lining. And then I look at other things too. I want to measure inflammation. I want to look at white blood cell count. I want to look at leukocytes and neutrophils. I want to look at glucose metabolism, because the gut is so intricately involved in insulin resistance. So I do look at the microbiome. I think this is somewhat controversial, and a lot of people would say it's not quite ready for prime time. But what I tend to use is Rob Knight's test, which also is one of the most affordable. I previously used uBiome, but
Right.
the FBI just raided them, so I don't use them anymore.
Really? I didn't hear about that.
Yes. So I do some of the basic, comprehensive stool analyses, like with Genova or Doctor's data. I try to mention at least a couple of labs here so that I'm not associated with just one. And I like to look at functional tests, things like calprotectin, as well as lactoferrin, SIG-A. I've done a lot of testing of intestinal permeability. I wish we actually had better tests of intestinal permeability.
Yeah.
I end up with kind of a mix, and I want you to answer this question too. I end up with, lactulose mannitol as the gold standard, although I wouldn't really say it's gold. I think it's more
Right.
aluminum or tin. And then I look at things like zonulin, Cyrex array. But tell me what you do. What kind of testing do you do?
A lot of times we'll do a stool test that includes zonulin, but a lot of times it's not positive, even when we're pretty sure that they have leaky gut. So in most of the patients who have any kind of dysbiosis, I'm just assuming that they have leaky gut because it's so common.
Sure.
We used to do the lactulose mannitol test, but it's not my priority right now. So I'd rather know what's going on in the gut, that we can try to rebalance things first.
Absolutely.
So I'm more interested in doing a good stool test.
I agree with that. I mean, I think about the lactulose mannitol test, and I've been using it for maybe 15, 20 years whenever I first started doing this. And I think about, sitting on your back porch, drinking a glass of organic red wine. And I know if I do the lactulose mannitol test on you before you have that glass of wine versus after you have the glass of wine, it's probably going to be different, because we know that alcohol is what we feed animals to.
But I sprinkled some probiotics in my wine.
Oh, good. Okay. You're well covered. A little bone broth chaser.
Exactly. So, you talk about various toxins in your book that can affect brain health. What are some of the most common toxins that affect brain health that Americans come into contact with? I know you just mentioned glyphosate. What are some of the others?
Well, unfortunately, the list is very long.
Yes.
I think heavy metals are at the top of the list. And, we all know about mercury toxicity. That's something that I've talked about a lot in my books. But I was amazed to find in myself, as well as in my patients, higher lead levels, higher cadmium levels, higher arsenic levels. And, I think increasingly our food and water is exposing us to some of these toxins. We know that EMFs, for instance, have some modest data. It's not as strong as I would like it to be, but it's a little tricky with EMFs.
Right. So you're talking about the radiation from cell phones and laptop computers and Wi-Fi in our home, et cetera.
That's right. So that's associated with a couple of different brain cancers. We know that it increases oxidative stress, especially if you're holding the phone next to your head. We think that probably increases risk. So bisphenol A is another one. BPA is sort of brought up anytime we talk about endocrine disruptors, but it's much deeper than just a xenoestrogen or a disruptor of insulin, which it is. It's an obesogen that makes you fat and insulin resistant. It does other things to the brain in terms of disrupting the hypothalamic pituitary adrenal axis. So it's one of the bad players. I've got a list. You made me think of the table that I have in my book where I go through kind of a list of these toxins. The other thing I think about with lead is that it's a dementigen. So it's one of those toxins that robs you of IQ points.
Right.
And we don't want to be exposed to this, but we know, from the example in Flint, Michigan, that many of us are exposed in our food supply. I found it in my lipstick.
Yeah.
So for those of you who are listening and you are a woman or maybe gender non-binary and you wear lipstick, take a look at your lipstick, because if it's not organic, there's a good chance it contains lead.
Absolutely.
So I have a few others listed here. I mean, household cleaners that contain phthalates, fluoride in toothpaste, flame retardants that are in furniture, sunscreen that contains PABA, mosquito repellent with DEET, that new car smell, that's a toxin for the brain. It disrupts thyroid function too, which can, affect your brain's ability to focus. And then there's a long list of food. But I think water and air are some of the exposures that I think we really need to be thinking about, not in sort of a doom and gloom way, but how do we reduce exposure on the one hand? And then how do we detoxify?
How do we detoxify? What's the best way to get rid of heavy metals and some of these other chemicals?
Well, this is a great question. So this is fun to riff with you because I imagine you've been dealing with this for a few decades.
Of course.
And when I first started dealing with it—
I've been in practice for 30 years. Yeah.
You've been in practice for 30 years, so longer than me. And, I was taught when I went through my training to use chelators. And so I had a whole system for how to do that. And what I've learned, especially from Chris Shade over the years, is that it may be better to focus on glutathione and to support the detoxification pathways in the liver. So I've shifted. I mean, there's a time and a place for chelators, but I have shifted toward really focusing on glutathione as the master detoxifier and antioxidant. But I'm curious what you would say in response to this.
Well, no, I totally agree. After, finding out about so many patients that we sent, referred for chelation who got worse or,
Yes.
Had all sorts of adverse symptoms, and even after long courses that the glutathione and then binders to kind of capture it seems a much better strategy.
Yes. So I've been using his push catch quite a bit recently, and I like his binder. I looked at the data on binders, and I wish we had more robust data on the binders. I use them. I think activated charcoal is probably the most proven, but I like his push catch system.
Yeah.
I can't think of an alternative that's similar to that. I mean, there's lots of companies that make activated charcoal and other binders.
Right.
Do you have any other supplements that you use for binding?
We've used modified citrus pectin. I got into a whole discussion with Chris about this. He doesn't think that's a very good binder, but Isaac Elias has some data showing that it binds lead and certain other heavy metals pretty effectively. So that's one we'll throw in there.
Yeah.
Chlorella.
Right. Yeah. So, there's hope that makes a difference. And there's certain foods that I think can really help you with glutathione. I don't think for some of us that it's quite enough. Like I'm someone, I don't have glutathione S transferase. And so I just need to take liposomal glutathione.
Right.
And I have a fair number of patients, the canaries in the coal mine, the ones who really have the symptoms from toxic overload tend to have trouble producing glutathione. So yes, you can get it from your food. Always a good idea to start there first. But I think a lot of people who have to detoxify need something more.
Right. A lot of people talk about onion, garlic,
leeks,
as being beneficial for stimulating glutathione production.
Right.
And of course, NAC, which we've used for years, which is an amazing compound for so many things.
I love N-acetylcysteine because it's got such a great safety profile, and yet it's so well proven. I mean, this is one of the few supplements that I would say mainstream medicine has actually embraced, because we use it in the emergency room when someone comes in with Tylenol poisoning, as an example. Exactly. So I think it's one of the, I'm always looking to how do we build bridges between the allopathic world and this more integrative functional world. And I think with proven supplements that have randomized trials like N-acetylcysteine, that's where we start.
Yeah. Well, good luck.
Exactly.
I'm sure
how much energy do you have?
I'm sure there'll be a negative study on NAC next week
exactly.
in American Journal, in the AMA Journal.
That's right.
So if you have what would be sort of a set of tests that you might do? Let's say you have a patient who comes in, they're complaining of brain fog and memory problems, and you go through their history. What might be a sort of set? We've talked a little bit about panels, but I'm wondering, what would be some of your go-to panels?
Sure. And let me just apologize because I have no air conditioning and it's 100 degrees outside because my power just went out. So I'm going to strip here.
Oh,
So
okay.
it might make more people go to the video. We'll see.
Exactly.
Maybe not. So yeah, this is such a good question. Again, I'm a hormone doctor. So the way that I think about this, especially in a woman over the age of 40, is I'm thinking first about estradiol, because estradiol is the master regulator in the female body. We know that when it comes to perimenopause, even the most subtle early changes that begin at 40, that there's a central effect with cerebral hypometabolism as a result of the loss of estradiol. And you may not measure it peripherally. So you could do a serum test, a blood test measuring estradiol, and you may not see a change. But there are brain effects that have been documented very well by Lisa Mosconi at Cornell, showing that 80% of women have cerebral hypometabolism. So they start to have the symptoms that you're describing. Brain fog, they walk into a room, they can't remember why. They start to have vasomotor symptoms, maybe sleep becomes disrupted, and it becomes kind of this snowball that I think leads to much greater health risk as they get older. So what kind of panels do I do? I start with serum panels, because again, that's part of building this bridge. I think we've got good evidence with serum estradiol levels, as well as other hormones like cortisol and DHEAS and testosterone, free and bioavailable in total. I look at progesterone. And then I'm a big fan of the Dutch test. I wonder if you do this too. I think it gives you so much more information in terms of estrogen metabolism, how much metabolized cortisol, the total cortisol load. How do you use that?
We just started using it. I was doing like the 24-hour urine test because I like to look at the metabolites because I think that's super important for breast cancer risk and everything else. But so we just started using the Dutch test more. And I think it's great. And it's so convenient, easy for patients to use.
It's easier than saliva testing. I actually think, at least what I'm seeing in my patients, I think the data is more reliable. And it's, I've just found that it's been a real game changer in the way that I take care of patients. So that's one of the panels. The other, kind of basic functional medicine panels that I do, I tend to use a Genova NutriBal. Yeah. Other people use the ION. Other people are religious about organic acid testing. I do that as well. But I tend to start with a combination of serum testing of sex hormones as well as a larger panel. I always think about glucose metabolism because we know it's disrupted in at least half of our patients, if not more. In fact, I wear a continuous glucose monitor because I think glucotape is so important. And our ways of measuring abnormal glucose signaling, I think, are 30 years ago. They're so 30 years ago. Fasting glucose, fasting insulin, hemoglobin A1C, we miss a lot of patients who are like me, who have a sweet potato, and my glucose goes up to the diabetes range. And that's, I can talk about the reasons for that, but I think understanding how this might map onto symptoms like brain fog and, this gut-brain axis issue is really essential. So those are some of the tests that I tend to start with. What about you?
Great. Yeah, no, I love the NutriVal. I love the fact that it includes organic acids, amino acids, fatty acids. It's got some heavy metals. It's got some oxidative stress markers. So it's a really neat sort of general screening tool. So I love that.
It's kind of one-stop shopping.
Yeah. Yeah.
And I like to keep this as simple as possible. And it also, I think, for the most part, for patients who have insurance, it's well reimbursed. So, they have a good pay-assured price. So I like to do that to start with. I mean, it often you end up kind of dissecting after a NutriBal. I tend not to do serial NutriBals. I kind of use that as a screening test. And then from there, I'll order organic acid testing, like from Great Plains. And then I'll do some additional stool testing, and I'll look more at heavy metals. I tend to use Chris Shade's quicksilver testing to look at heavy metals.
Oh, okay. Have you done a provocative urine testing?
Well, I've done a lot of provocative urine testing kind of over the years. I do less of it now. I still think there's a time and a place for it because I I believe in Chris Shade's science for the most part. And I think his way of measuring heavy metals makes a lot of sense to me. Um, but there's mixed data on provoked testing. Here's where I think it's helpful. We know, especially for women who reach their peak bone mass at somewhere around 30 to 35, that they tend to store a lot of heavy metals in their bones. And so I think provocative testing, especially in a woman before age 50, can be very helpful to try to unroof some of that heavy metals that are hiding behind the bone matrix.
Yeah, I think that's actually one of the keys for detox is if you've got a woman who's losing bone and she's liberating more heavy metals, you're never going to get rid of the heavy metals until you stabilize her bone metabolism.
That's right. Totally agree.
Let's see, we talked about that. So you write about the importance of sleep for brain health. And you write in your book, lack of sleep affects neurogenesis, particularly in the hippocampus. You can even develop false memories if you lose sleep. So if you were to stay up half the night tweeting, you might think that thousands of people who are protesting you were actually cheering you. Just kidding.
Very funny. I didn't realize we could talk about politics too.
I'm kidding. But can you talk about the importance of sleep?
Sure. Absolutely. I'm also happy to talk about politics.
No. I don't talk about politics.
Just came back. So I'm keeping over here. Yeah. So, I was just listening to a podcast with Matthew Walker where I felt like he got into the details of sleep in a way that I've found really captivating. So what he talks about, he's a sleep researcher, PhD, so he doesn't have clinical experience, but what he believes is that it's your deep sleep that's associated with clearing amyloid beta and other toxins. So we know that the glymphatic system becomes its most effective when you sleep at night, and you have to have kind of that full conversation for the glymphatic system.
Can you explain what the glymphatic system is?
Yes, so the glymphatic system is kind of like a shampoo for the brain. That's how I describe it to my patients. It's where the spaces, the interstitial spaces in your brain kind of open up, and this cleansing process happens through your brain. So it's not the lymphatic system. It's got a G in front of it. So the glymphatic system. And it was only discovered, I think 10 years ago. It's a relatively new thing that we found. So the glymphatic system seems to work the best when you sleep on your side, especially the right side. And deep sleep is really essential for this. So I use an Aura ring to track my sleep. Cool. And it's not quite the same as a sleep lab, but I think a sleep lab is often very artificial. Yes. And I don't know that it gives you the best data other than to tell you whether you have sleep apnea or some other, clinical diagnosis. Right. But for the average person who's trying to improve their sleep, like their deep sleep and the REM sleep, I think sleep tracking can be very helpful. You don't have to do it every night. I think just kind of getting a sense of what your issues are and then working on them, kind of designing an N of 1 experiment can be very helpful. And then REM sleep, we know, is really important for emotional regulation and for prevention of things like anxiety and depression, as well as other what are called mental health issues, and I think are basically health issues. So I think of deep sleep also as that place, as you mentioned, it's where neurogenesis occurs. And it makes sense to me that not only are you clearing amyloid beta, but you're also doing memory consolidation and you're working on emotional regulation. So those are some of the things that happen with deep sleep. Do you track your sleep?
I have in the past. I haven't recently, but I definitely, of all the things I do to promote long-term health, it's the one I'm least good with.
Well, I think it's as close to a panacea as we have. And, it's interesting to me because I feel like there's certain topics, Ben, that people's eyes glaze over when we talk about them. And I would say sleep is one, stress is another, sometimes food. People are just like, oh, yeah, I got that. And yet we know that that common sense is not common practice. And so I feel like it's on us to talk about sleep in a way that really magnetizes people to understand how it's going to help their health and what concrete steps they can take to make a change.
Right. You mentioned food. What role do food sensitivities play in our risk for diminished brain health? Should we all avoid gluten and dairy?
Well, certainly gluten and dairy are the most common food intolerances, and I see that all the time in my patients. I don't know that all of us need to avoid them. I mean, I can tell you that I've got 2 daughters, and they both do fine with gluten and dairy, especially the gluten in Europe. They do especially fine with the gluten in Europe. They don't have food sensitivities. And I think it's remarkable given how stressed teenagers are right now with social media and iPhones and other pressures that they experience. So I find that food sensitivities are incredibly common. The way I think about it is that it tells me that someone has increased intestinal permeability. And so I want to always be thinking of, okay, what's the root cause? How do I help them with their symptoms? But how do I also address the root cause? How do I improve the integrity of their gut lining? And, you know, I'm curious what you would say about this, because I've found over the years that it's kind of a big project to improve intestinal permeability. Like, it's not the kind of thing where you just give them a jar of glutamine and say,
Right.
you know, see you in 6 weeks and they're done. It's not like one and done. It's a much bigger project than that.
Yeah. Multi phases. You've got to try to see what's, out of balance in their gut, and you got to try to reduce the pathogens and the dysbiotic bacteria and fungal overgrowth, and, get the inflammation down and strengthen the immune system of the gut and do all those things. And then you've got to try to repair the gut. And then, sometimes food sensitivities become a problem. So you've got to sort through those. How do you like to sort through food sensitivities?
Yeah, this is another one of those moving targets, I think.
Do you use Cyrex food sensitivity
I use
testing?
Cyrex. I somewhat reluctantly use Cyrex. So I think it can give me some helpful information, but often what I find is it just tells me what I know already, which is that I have to work on, a 5R protocol for the gut, and we have to focus especially on intestinal permeability. I used to use ALCAT. I used to do.
There's many food sensitivity.
There's many different food sensitivity tests, and so I use some that were more convenient than others. There's some that allow you to do home testing. And I found over time that they're sort of less useful than understanding that the patient in front of you has increased intestinal permeability, and pretty much anything they're eating, they're going to become somewhat intolerant to. So to me, I think the name of the game is to understand what someone's triggers are and to help them as close to the root cause as you can. So, but I also am careful not to do what I think of as root causism, where all we're doing is addressing the root cause and we're not helping the patient feel better as fast as they want to, because they have to see results to continue to buy in.
Yes.
So I think we do have to treat symptoms along with addressing the root cause.
Absolutely. Yep. And then, of course, we always have the elimination diet, which is, the true.
I actually, I'm a huge fan of the elimination diet. I was just looking at some data from so long ago on rheumatoid arthritis and the use of the elimination diet, showing, really strong data showing this is so beneficial. And I read that and I think, oh my gosh, why doesn't every rheumatologist know this? So I'm a huge fan of elimination provocation. I think that's in many ways more useful information than an expensive Cyrex array or some other food sensitivity testing. The problem is a lot of patients, by the time they do 3 weeks or 3 months of a food elimination diet, when they're adding food back in, what I find time and again is they are not patient. Like, they don't do that, 1 dose a day, watch for 3 days to see response. They kind of lose their minds and they have a piece of pizza and they have gluten and dairy and tomatoes and nightshades, and
And then they get symptomatic all over again.
And they get symptomatic, and you just lost all that time. So I am a huge fan of a carefully constructed elimination provocation where the patient really understands, okay, you have a clean canvas now at the end of your 3 weeks or 3 months, and we need to take our time and really understand your response to these test foods.
Yeah. So let's talk about hormones and their relationship to brain health. So
yes, what would you like to know? I could talk about this all day long.
I know that's your favorite topic. So
yes, it is.
Post perimenopausal, menopausal women who are, having symptoms related to hormone deficiencies, estrogen, progesterone. Should we substitute bioidentical hormones? How much is that going to benefit their brain health? Which women should have that done? Should we try other alternatives first?
Yeah, it's a great question. So the way that I think about this is a pretty simple network medicine, functional medicine, precision medicine formula, which is I start first with what symptoms she's having. So maybe it's a 40-year-old with brain fog. So I'm going to start first with doing testing and kind of understand what the root cause is, as well as addressing the symptom. I'll probably put her on an elimination diet. And for me, step one is to fill any nutrient gaps. So we may find that she's a little low in B12 or B6 or folate. And so we may top off some of those nutrients that she's missing. Absolutely. Maybe she's low in vitamin C, and so she's not making enough progesterone. That's often a low-hanging fruit for someone who's 35 to 50.
That's a great clinical pearl. Yep.
Yeah. And then step two, if that doesn't resolve symptoms, I'll start to look a little deeper at what's going on with hormone balance. And what I find in the first phase of perimenopause, which is where progesterone drops, but estradiol can be fluctuating wildly. What I often find is that chasteberry is a really good solution because it modulates progesterone levels. It's been shown to raise serum progesterone in randomized trials. And it's one of the most proven herbs that we have in perimenopause. It doesn't work once you stop ovulating, but there's a window of time where I find it works really well. And then if that doesn't resolve symptoms, then I move on to bioidentical hormones. And I'm someone who's pretty careful about it. I would say I'm not, on the spectrum of the people who are really heavy-handed with bioidenticals and, use, we can get into that topic, versus people who are, scared to death of prescribing hormones. I would say I'm in the middle, where I like to do genomic testing. I want to understand what's your risk of clotting, what's your risk of cardiovascular disease, how do we make a risk balance alternative balance sheet for you and kind of have a sense of here's what your individualized risk is and here's why I am coming out in favor of or against using hormone therapy. But at the same time, I would say it's not a yes/no question. I think it often is what type, what dose, what's most proven. You asked specifically about the brain, and I know you asked that for a specific question because we know that the emerging data is that there's a window of opportunity for taking exogenous estradiol, and the window is much smaller, I believe, for brain health than it is for, say, cardiovascular disease. So we know from the Women's Health Initiative, as well as some other trials, that the window is about 10 years for cardiovascular disease, and it's potentially dangerous and provocative to give it beyond that 10 years for menopause, so after age 60. Although I have patients who consent to that, they understand the risk. But I think when it comes to the brain, there are these subtle changes, the cerebral hypometabolism that I mentioned that starts in 80% of women over the age of 40. And I think that's the window for giving estradiol. So I think we have to consider this as more a problem of middle age, a problem of women in their 40s and 50s, and really consider the benefits and the risks of prescribing bioidentical estradiol in that population much earlier. And we have data on this from women who go through surgical menopause, that earlier treatment makes a big difference in terms of brain health. The problem is we have, kind of the wrong study, which is giving Premarin and Provera to older women over the age of 60, and it increased the risk of dementia.
You're referring to the Women's Health Initiative, which used these synthetic forms of estrogen and progesterone and gave a lot of them to women who were in their 60s or 10 years or so past menopause.
That's right. And what we found is that it actually increases dementia. It may increase Alzheimer's disease. But I would say the problem is it's too late. And we know that when you put estradiol together with neurons, there's a point, almost like a switch point, where the neurons respond well to the estradiol. We don't know what that age is. It might be sometime in your late 40s, maybe early 50s. And then when you give it after that, it can actually accelerate the decline of those neurons. So there's this window of opportunity that we have to define better. And as we wait for better data, I can tell you that I prescribe estradiol to my patients. I usually give like a 3/4 dose, like a estradiol patch, 5L patch, 0.0375 milligrams is one of my favorites, together with prometrium is what I think is most proven. That's a standard prescription that I give for my patients who are in their 40s.
Okay, great. We talked a little bit about nutritional deficiencies. I think that's pretty much all the questions I had prepared for today.
All right. Well, it was a fantastic list of questions. I really appreciate it.
Thank you. Thank you. Any final thoughts or insights for our listeners about the brain-body connection?
Yeah, I'll finish with a quick story because I love how Brene Brown talks about how stories are data with soul. In 2017, I took a month of antibiotics. I'd never had antibiotics before. And I turned this into an N-of-1 experiment where I measured my microbiome before and after. But after that month of antibiotics, I had anxiety for the first time in my life. And I gained about 15 pounds. I had insulin resistance and a lot of trouble with my fasting glucose and fasting insulin. And so that's what got me to go to the literature. And that's where I found this association between a course of antibiotics and the increased risk of anxiety, depression, learning and memory problems, obesity, insulin resistance. And I can tell you, when I went through my medical training, I was never told to give this kind of informed consent. So I feel like this is a real game changer. And I'll give you one teeny little piece of data from my N-of-1 experiment. When I measured my microbiome before and afterwards, I had an 87% reduction in the diversity of my microbiota. That's pretty huge. And that's anecdotal information. It's only, one subject, but it's a subject who was studied over time in a scientifically valid manner. And in many ways, what I was taught at Harvard is that randomized trials are really important, but the N-of-1 study is even higher in terms of evidential hierarchy, because it allows you to personalize, it allows you to really know the individual and not base your decisions on a population. So I feel like that's where we're heading. I mean, that was part of what motivated me writing this book and really diving into the literature. But I feel like that's where we're heading with the way that we practice medicine, is to understand, we've got to think about how to address, the reason why I took these antibiotics after my surgery. There might be a better way to do this that doesn't, isn't a nuclear bomb for my gut microbes. And for those of our patients, it's not me that's so interesting. It's that so many of our patients go through this. I've been prescribing antibiotics for 25 years, right? This is news to me, and it really changes clinical practice. I pay attention to those things that have really changed since we went through our medical training.
Right. Are you still in clinical practice?
I am. So I went on sabbatical, but I have to tell you, I have like 10 patients that just would not let me go. So I still have these 10 patients. And then I'm planning to open my practice again next year. We have a clinic that's opening in Aliso Viejo, kind of a clinic of the future.
Okay.
So I'm planning to see patients again starting next year.
Okay, great. So how can listeners find out about your book and then find out more information about you through your website?
Yeah, the best place to go is brainbodydiet.com. That's where we have a lot of information. We've got an anxiety documentary coming up, and that's where they can learn more about the book.
An anxiety documentary. Cool.
Yes. Which is basically functional and integrative medicine to address anxiety instead of just throwing benzodiazepines at it.
Awesome. Thank you so much, Dr. Gottfried.
Thank you. Such a pleasure to be with you, Dr. Weitz.